we need to be getting our C-section moms moving, and we need them to be moving early after surgery. In today's video, what I want to be talking about is some brand new evidence that is looking at nurse-led and recovery protocols after cesarean section. Before we get into the new research, I really want to talk about why this is so important. In rehab in general, in any post-surgical space, we have gone from the recommendation of stay in bed and don't do anything to, oh, we were really wrong about that. We should be getting people moving early and often because it helps with outcomes. If we look at things like knee and hip replacements, we used to have people in bed for a week, and then they were getting contractures, their healing was really poor, and early ambulation was shown to be really effective. After a heart replacement, you get your valves replaced, you have a triple bypass surgery. We used to have people in bed, and now you are up and moving around the ward and progressively more throughout the days that you are in hospital. This has led people to be discharged from hospital way sooner, which is a good thing, right? Because you have the risk for hospital-acquired infection anytime you are staying in hospital too long. And it's not exactly restful to be in a space where it's not your bed, it's not your house, it's not your comfort area, and there's all these disruptions and things going on around you. In the birth space, we are still in a spot where anytime I post about early movement, people say, I need somebody to tell me to sit the F down, or you could just enjoy your baby and not worry about it. But the reality is there are negative health consequences to not moving enough in the post-operative period. And so not only am I advocating for people who want to be moving to be able to have their own timeline as long as there's no medical contraindication, but also our evidence, especially after surgical birth, is showing how important it is to be active. And so this started with our understanding of the walking to a better future. So we had evidence before this. I don't want to miscommunicate, but this study looked at how much women moved when they were in hospital with cesarean section, post cesarean section, and what that meant for their complication rates. And what they saw was that those who have given birth via cesarean before were more likely to move than those who this was their first delivery. And that there is a noticeable difference in step count between those who had post-operative complications and those that didn't, right? So this is starting to blend and create this argument that, hey, maybe if we want to avoid things like DVT and other issues, that we might want to think about getting people moving early. And so what this study helped to do is pave the way for some of our ARIS guidelines post-cesarean delivery. So ARIS is the Enhanced Recovery After Surgery recommendation. And when we look at our current recommendations, and this was published in 2025, what we showed was get individuals eating and drinking early. And the strength of the recommendation is early mobilization and ambulation is really important. And I love this one too, of the early removal of a urinary catheter. Like, get that out of here. But what this is showing is that the recommendation is that within 8 hours of your delivery to begin to be moving around the unit. Like, the recommendation is that you need to be moving around, which is great. And what it's going to do is it's going to help with recovery and return home. And so this is great. But if you look here, the quality of the evidence here is low. So there's something else that we have to be doing and thinking about. And so just a couple months ago, end of May, beginning of June, this was published ahead of print, so it's not even in an issue yet. There was a new RCT that came out, which levels up our strength of evidence pretty significantly about early ambulation after cesarean delivery. And so this was a two-prong RCT where they compared normal care to those who were on an early ambulation protocol. These women were in hospital for 4 days, which compared to where I am at, that is a little long. Usually it's 2 to maybe 3 if there's something going on. And a lot of moms are really wanting to get home. So 4 days is a lot, but they took half the group and gave them the standard protocol, and half the group was placed on an ambulation schedule that was starting from early post-op day 1. If I can get up here to their protocol, here we go. Their protocol on day 1 was deep breathing, followed by upper and lower body exercises while in bed, position changes from day 1, and then followed by sitting at the bedside. And assisted ambulation was initiated at least twice daily with gradual increases in duration and distance based on clinical tolerance. So that was started day 1, like early rehab, early movement, early ambulation was initiated. And so when you look at their outcomes, right, and what they're showing here is like the baby differences from the control group to the intervention group was not different, which could hugely influence how moms are feeling. But when you look here, and this is like such an important outcome, constipation was way lower. Depression scores were lower, anxiety scores were lower, health scores were lower, and the obstetricians' perception of the quality of their recovery was almost significantly lower. So this one's approaching significance. But all of our patient-reported outcomes are way better when ambulation was promoted early, right? I see moms all the time who are still being told that their daily walks are too much after their C-section. And what our evidence is showing is that is absolutely not true. Where we need to be going is we need to understand that movement is really important for recovery. Movement without clinical buoys can maybe overdo it. But I feel like for every step forward we're taking, and hey, it's really important for you to move your body, I'm getting slapped with other people who are like, what about passive tissue healing? And what about like bonding with baby? Or moms already have enough to focus on. I'm not saying that you need to force moms to move, but I am going to encourage moms to move to help their recovery. And part of the reason they're not moving is because they have been so like the message is so fear driven that they feel like they can't move. They feel like they can't. I just responded to a reel from a fitness person who said, I'm not listening to my body, I'm listening to my doctor. And I was like, what are we talking about right now? And so we really have a far way to go. As evidence like this comes out, it gives me more strength of advocacy for my clients. This RCT was nurse-led, love that, but I would also love to see a time and a place where rehab is on those maternity units. And I know that it's coming and we're seeing it more, but it's such a great place for us to be and such an important reminder that movement, obviously with intolerance and gradual, is important in that early post-operative birth space. Hope you enjoyed the video. Let me know if you have any other questions.